Hello and welcome to the Washington AHEC Scholars Podcast. My name is Jordan. I am one of the instructors for Washington Area Health Education Center courses. I'm joined today by Dr. Patrick Rowie, who is a clinical psychologist in the Department of Psychiatry. Today we're going to be talking about integration of behavioral health in several different healthcare contexts. Welcome, Dr. Rowie.
Thank you, Jordan.
Yeah, how are you doing today?
I'm good, thanks. Happy
Good.
Friday.
Happy Friday. It's the first Friday of November, and I'm already feeling that big dark, so it's kind of fun to be
Yeah,
talking about mental health on a cold Friday.
great.
So how about we'll just get started right away. Can you tell us a little bit about yourself, the work that you do, and maybe like what led you to where you are today?
Sure. So I'm a licensed clinical psychologist, and I'm a professor here in our Department of Psychiatry. And as a researcher, my work has focused in a couple of different areas. One is depression in older adults and the best ways to identify depression and manage or treat depression, particularly using behavioral interventions. So I've studied psychotherapy approaches. I'm currently leading a large study of lay delivered behavioral interventions in community settings and senior centers in particular. And I've done some work on preferences and shared decision making. Another line of research has been the integration of mental health into primary care settings and the best ways to kind of do that for adult populations. And so that's my research background, and briefly educationally, I head up the behavioral interventions at our AIM Center, which is devoted to disseminating collaborative care and other integrated models throughout the country. So I do a lot of thinking about how to take traditional psychotherapies and modify them so they fit within a busy primary care setting with a lot of different providers. So I think about licensed psychotherapists, but I also think about the full primary care team and what they can do.
Okay, yeah, that's man, that's a lot of interesting background as well as like bringing that mental health, behavioral health integration to the fore. We have quite a bit of variety of students from different healthcare occupations in our AHEC Scholars class. We do have, I think there's a handful of this year of mental health counseling students, but then for the most part, they're, nurses and medical doctors and dental students. Can you speak a little bit to like even for somebody who you wouldn't necessarily think wanting to have some training in behavioral health, say a dentist, how could that be valuable in their practice?
Yeah, great. Really interesting question. I think in thinking about integrated care and what the whole team can do to support. I think there are many things that can happen behaviorally beyond formal psychotherapy treatments, and I think in particular, physicians and nurses and any other kind of provider can be thinking about one encounter and what they can do to, once they've identified a mental health issue, how to engage patients in the idea that some kind of care can be helpful. And there are a lot of evidence-based strategies that can be done even briefly in a single session. And some of those strategies are psychoeducation. So getting to a shared understanding of what the mental health issue is and what it's due to and how it can be treated. There are motivational interviewing strategies that can be used when a patient has ambivalence about pursuing some kind of care, and to not be pushy about giving a referral or a prescription, but really meeting the patient where they're at. And then I mentioned shared decision making earlier. That kind of takes it to the next level as far as engaging patients and hearing their story and kind of using some decision aids to really go through the different treatment options and the pros and cons and come up with a mutually agreed upon decision. Originally, those strategies were, in the medical field, right, with cancer diagnosis and treatments, but that way of thinking and those strategies can really be applied to mental health conditions as well.
Okay, great. So that definitely gives us a solid foundation to build upon of why everybody, all healthcare providers should be interested in behavioral health. So you mentioned collaborative care. What is collaborative care, and can you give some examples of how cross collaboration across disciplines in those integrated primary care settings would use collaborative care?
Absolutely. So collaborative care is, we can sort of think of that as a type of integrated care, but a very systematic approach to integrated care. And it's based on the Ed Wagner chronic care model of diseases. And some of the key features are, first of all, having a devoted primary care practice that has committed to this approach and has hired a behavioral health provider. This is often a master's level social worker, can also be a registered nurse or a psychologist. And their role is really to be there for a primary care provider and to receive what we call a warm connection from the provider when they've identified a mental health issue. To meet with patients and spend more time with them and do some psychoeducation and ideally engage in shared decision making. Collaborative care also involves using regularly administered outcome measures. So the PHQ-9, Patient Health Questionnaire for Depression, for example, every time a patient with initially elevated depression presents their care to see, well, first to pick up patients who need care and then to track their improvement over time. Often in collaborative care, an actual electronic health registry is focused on depression is used and incorporated so that all members of the team can track over time how patients are doing and responding and knowing when treatment needs to be intensified or switched. And two other pieces. One is there's a direct provision of evidence-based care. This could be antidepressant medication or other psychotropic, but ideally that behavioral health provider is trained to do these short-term behavioral treatments also. And that's a big part of my work. The last important piece of collaborative care is having a psychiatrist consultant. This is often a small amount of time, but really important. Somebody who can join team meetings maybe once a month to help the team track progress of patients who aren't responding and to give some recommendations to the whole team about either medication and the right one and the dose, but also support the behavioral treatment too. So those are all of the components of collaborative care.
Yeah, there's quite the gambit. There's a broad spectrum of different areas to cover, as well as different ways that different healthcare providers can be involved. So maybe like a follow-up question to that would be then, like, where do those psychosocial interventions fit into an integrated setting? Perhaps even talking about like what each different, maybe give an example of one or two different professions and how they can be involved.
Yeah. I think it's helpful to think of a spectrum or sort of a continuity of where they can fit, because many places. And the first is, thinking about these brief targeted engagement strategies that anybody can do once a mental health condition or issue has been brought up. And so it's all about engagement. So thinking of psychoeducation, thinking of motivational interviewing and shared decision making. So anybody within the team can and should be using these approaches really deliberately and thinking beyond just kind of standards of patient-centered care and honoring patient preferences, but really using these strategies deliberately to educate and help work with the patient on pursuing treatments that could be really helpful. The next level are these sort of time-limited focused psychotherapies or behavioral treatments that trained providers can use. And these are often the master's level social workers, but registered nurses can be trained in these approaches and other members of the team if the primary care practice decides that's part of their job responsibility. So problem solving treatment for depression, it doesn't have to be delivered by a psychologist, but a trained social worker, a trained nurse, et cetera. Time limited, often 4 to 6 to 8 sessions can really result in really substantial improvements in somebody's depression, behavioral activation for depression and anxiety, cognitive behavioral therapies, effective as well. Even some work has shown interpersonal psychotherapy is one of those effective short-term approaches that's based more on a short-term psychodynamic model. So I've talked about the engagement strategies. I've talked about the brief treatments. And just the last level to keep in mind in primary care for patients with more chronic or treatment resistant depression that's not responding to care within primary care, there's always the option of referral out to specialty psychotherapy and if it's accessible and available, but ideally should be in close collaboration with the primary care team. So patients aren't just farmed out, but they're still really being followed really closely by the team.
Yeah, those are some good points. The through line that I'm kind of following here is like that if you're having that holistic approach to dealing with patients, then you would care about anything that you see when they present with you. Like I was thinking, like even a dentist, I when I go to my dentist now, they take my blood pressure and they put all this kind of stuff in my chart, and I ask the assistant, like, why are you doing that? She's like, well, we're, a more holistic approach is you're a touching point with the healthcare system, so we could collect information on you. So maybe if you were at your dentist and they notice like you're maybe extra stressed out about something, then that could be something they could consider, even though they're not, you're not going to your dentist for psychotherapy, but they could potentially notice an area that you would want to see that referral that you mentioned.
I like that too. There's a lot of opportunity to screen in a lot of different settings for mental health issues like depression, anxiety. Um, just one caveat: it's really important that that care team then has resources and
Mm.
referral sources to offer patients, and so not just screen and see a problem, but to have some options for patients that they can follow up on that.
Yeah, that's a good caveat. Again, like my own experience, I one of the last times I had some major dental work done, I kind of had a little bit of heightened anxiety, and they did. The dental hygienist was really kind and said, if you're struggling with anxiety, this is potentially somebody you could go seek assistance from. And so I appreciate that point. It's like I think we are fortunately starting to see like a shift in that holistic approach of care, where every healthcare provider is looking for anything they can do to help in any way. Yeah. So like I mentioned, we do have a handful of students that we work with who are specifically training to be healthcare or mental health professionals. But by large, we don't. We like most of our students are not specifically going into that field. But why would they, like, what would you say to a student just why they should be interested in, behavioral health integration? Why should they have at least some basic training and understanding about how to approach working with patients in that way?
Yeah, I think to the point about that we were sort of alluding to, that it's not helpful to silo mental health as its own specialty area for a lot of reasons. I mean, the research has really robustly shown that there are all sorts of negative impacts to an untreated depression or anxiety. Not only it causes and all sorts of personal emotional distress, but it affects every aspect of the person and their engagement with all healthcare providers. Medical outcomes are worse, engagement in all sorts of medical care and physical and occupational therapy are going to be affected by depression, untreated depression, anxiety, even if certainly affects suicidality, and untreated depression, anxiety also leads to early mortality. Oh, not even including suicide related mortality. So I think to your point of holistic care, I think just being aware of mental health issues when they are persistent and need care is really important for every healthcare professional. And being aware of engagement approaches to do psychoeducation to normalize and to make folks aware of treatment options that are viable for them.
Yeah, those are good points. It kind of leads into my next question here. You mentioned earlier about like making sure that we're using evidence-based approaches in how we deal with mental health issues. What are some of the evidence-based bases for these psychotherapies being delivered in primary care settings?
Yeah, there's been a lot of research about how feasible, acceptable, and effective these modified traditional psychotherapies are in primary care. And one of the most well-studied approaches, and originally going back to the impact study in the late 90s that became the basis for collaborative care, that study used problem-solving treatment, an adapted version of problem solving to fit primary care. So that has really robust, strong evidence for treating depression in primary care. in integrated or other kinds of settings, particularly for depression, anxiety. Behavioral activation is another approach with solid evidence base. The cognitive behavioral therapies, interpersonal psychotherapy. There are also approaches to to pick up and treat alcohol substance abuse. That motivational interviewing is one of those approaches, but some harm reduction approaches as well. There are distress tolerance kinds of strategies that have been effective for folks in primary care. So that these are some of the range of the treatments that have been studied.
Okay, that's great. And then especially because you've had quite a bit of experience working in this field, could you even speak to a little bit about yourself, like having seen this transition from siloed mental health care into more of this collaborative approach?
Oh yeah, I mean, I think like a lot of psychologists, we were trained in a more traditional model and the 50-minute hour and outside of integrated settings. So and another implication of that approach is part of it is the incentives to keep patients. Sometimes mental health providers might be working from a model of keeping patients and keeping patients long term because they like patients and they like working with them. But it's there when you think about it from a more population health perspective and really increasing access and reaching everybody in need, it kind of changes the way you think about providing care. And that's why collaborative care approaches like everybody is screened and the ideal is nobody falls through the cracks. So you're picking up everybody and you're offering and you're wanting to be available to the patients most in need. So you're really paying attention to treating effectively and quickly. Doesn't mean get the patients out the door, but get a handle on what's working for them, and then freeing up your caseload to other people who are waiting. So you're not creating these huge waiting lists. So that's kind of a shift in the way we're thinking about mental health care, I think.
Yeah, that's really great. I think about my undergrad is in community psychology, and I had a professor who said once, like, if we were to try to train enough behavioral health providers to work with everyone, you'd have like 50% of the population would have to be trained. And so this collaborative care approach is like he kind of said that tongue in cheek, kind of jokingly. But what you're saying is this collaborative care approach is like actually we can kind of form coalitions with some other healthcare professionals, and maybe they're not specifically trained to be mental health professionals, but they can learn some of the techniques and some of the evidence-based cares that they can provide.
Exactly.
Yeah. So in the notes here, I have that there are three different strategies or components that you could really kind of hammer in on. So what are some of the brief psychosocial strategies that primary care providers can use to engage patients in mental health care?
Yeah, I'll talk psycho. I'll give a few examples about psychoeducation, and at minimum, it's naming the condition, and sometimes we provide one-page forms about the condition, and that's a great start. But I do like when I talk to people about using psychoeducation, I encourage people to think of it as a conversation. So we first find out about the patient's experience and their thoughts about what they're going through. What do you know about depression, for example? And have you had folks in your family with depression, or how have you found it helpful to manage that for yourself? And what are your thoughts about different treatments? Starting there, and then representing what we know, from the medical literature about what are the symptoms that go into depression and what are the causes. What do we know about what causes or maintains depression? What are the evidence-based treatment approaches so that we can support what patients are saying, but also gently correct maybe some of the myths they have about what causes or can treat depression. So that's what I mean by a conversation, hearing from the patient and that back and forth. And that can be powerfully and briefly done in the context of a single visit. If you're following patients up over time, it can be revisited later as well. So, and that's the spirit of motivational interviewing too. We don't try to change or tell patients what to do, and they may decide to do nothing. But if we have an ongoing, clinical relationship with patients, we can follow up and we can revisit and we can re-engage in conversation over time.
Okay, yeah, those are some great strategies. One of our year 2 modules is harm reduction, and as you're talking about how to approach psychoeducation in that settings, it makes me think of like you're planting those seeds of helping people like long term to reduce
Mhm.
overall harm. So, could you speak to a little bit more about motivational interviewing? I'm reading this here in my notes, and I don't actually know if I know what motivational interviewing is.
Oh, yeah, absolutely.
Yeah.
So this is an approach that was originally developed to help patients experiencing alcohol and substance abuse issues. But really, there are a set of strategies that can be used for when we're thinking about any kind of behavioral change, behavioral health care change. And I think one way to think about it is kind of as you said, building bridges. So to help support patients and guide them through a change journey. And it can be used in any case where the individual may be ambivalent about changing something. So they might see potentially, or maybe they don't haven't even thought about changing, or maybe they're thinking, oh, I would like to do something about this, but I'm not ready to pursue treatment. I'm not ready to stop, or this or that. So it's kind of acknowledging that motivation can be fluctuating and patients may not, if they're ready for change one day, they may not be ready for change the other day, and to not come down with a more paternalistic traditional approach about now is the time to change and here's what you need to do. But again, kind of hearing the patient's story, where they're at, from their perspective, what are the pros and cons of doing something about this troubling thing that they're experiencing, and certainly highlighting that what we call the change talk. So really reflecting and shining that spotlight on anything that the patient from their perspective says are positives about changing, and ideally highlighting that, and when they're ready, guiding them to follow through and take action on that at their pace and depending on what they'd like to do. And that, of course, segues to shared decision making. So all of these things really are related and build on each other.
So now I think like we have this good overview. If a student said, "Okay, I'm sold. This is exactly what I want to do," what would be a good first place for them to go? Is this something you can get certified in, or is there specific training for collaborative care?
Well, right. So collaborative care and entire primary care practice really has to commit to,
Hmm.
switching over this model. So it takes effort, it takes, leadership and everybody on the team to commit. So the AIM Center website is a great place to read a little bit more about what this involves and what the evidence base is and how to go about doing that. But that would be a clinic leadership kind of decision to make. But certainly, though, those who are in the mental health counseling field, there on that website, there are opportunities for fuller training in approaches that I mentioned, such as problem solving treatment or behavioral activation. So those can be pursued by anybody. Even private practitioners can pursue that kind of training.
So can you tell us about, are there any recent innovations in the field that are positively affecting how people are being trained in these approaches?
Well, yes, there's so something that we use, and I believe you may have introduced your scholars to is we've developed with some colleagues at the Department of Computer Science and Engineering an intelligent tutoring system adapted to teach people the basic strategies of any behavioral interventions that are kind of cross-cutting. So it's a way to use a really interesting way to use machine learning that people can a web-based application to do a self-guided, self-paced, interactive way to learn basic therapy alliance skills like how do we show empathy toward our patients, how do we use good reflective listening, how do we take into account cultural considerations and responsivity, but also moving on to session organizational skills like how do we set an agenda, how do we tactfully redirect patients to their priorities in the context of a time limited meeting. So I think this is, as I'm talking, applicable not only to a counselor or psychotherapist, but to all members of the team, these organizational skills. And the ITS also has modules training people on how to work with patients to enhance motivation using motivational interviewing, how to help them set goals and follow through, and do some action planning, how to review success or difficulties with that. And lastly, we've also developed modules for assessing suicide risk and managing that in the primary care or other setting. So it really has a lot of potential to not replace classroom work, but to kind of supplement that and get people up to speed even quicker.
Yeah, absolutely. And like you alluded to, we did for our current cohort, our last class sessions, we did integrate some of the ITS modules. And yeah, we had pretty much overwhelming positive response about that kind of learning environment. So I'm sure we're going to continue to incorporate that in our AHEC training too. How about some other like technological or other new breakthroughs in the field in general that is having an impact on behavioral health integration in primary care settings?
Yeah, there's a lot of really interesting, innovative things coming out. I was involved in a research study that we did about using automated text messages to supplement collaborative care for depression among older adults in particular, even though I think it has applicability to younger and midlife adults too. But really interesting way when a behavioral health care manager has limited time to spend with patients or the frequency of their visits kind of spread out, it's an interesting way to keep patients involved in thinking about their care. And it can be around increasing awareness of their mood and the context for that and what it's related to. And if they're working on self care, it can be very empowering to be aware of the link between your efforts and improvements in mood. It can also, these text messages can provide some extra suggestions for engaging in self care between sessions. So even though I'm really impressed that even though these text messages are automated, that patients seem to like it and respond to it, and the behavioral health care managers and teams seem to like it too and make them feel more continuity in the care. So that is it's just one example of an innovation.
Like really ways for people to stay connected and feel like they're, like you said, that continuity of care is a really big thing.
Mm-hmm.
Is
Mm-hmm.
that related to, I know you mentioned that you just did this study about like, oh, message-based psychotherapy. Is that kind of within that same wheelhouse?
It's in the same category of digital mental health interventions. So we did a big study that just came out in JAMA Network Open. We partnered with Talkspace, which is a commercial platform that uses licensed psychotherapists to provide message-based care. So this could be either texting or email. And it's a real therapist, sending messages, asking questions, giving support, and suggesting strategies. And we compared this to video-based psychotherapy provided by talks-based therapists as well. And we found them pretty equivalent, that they both were helpful in helping patients with depression reduce their depressive symptoms. So it just opens up a whole nother, and there were no adverse events. So it
Hmm.
opens up a whole another set of treatment options that some individuals can, thinking back to shared decision making, can pursue if they like. And it's really interesting because it can break down barriers of psychotherapy and increase reach, right? Because it doesn't involve a set time and a devoted time. It's more in the moment when you need it. You can text or sit down on your computer and and expect to receive a response from your therapist same day or within 24 hours, for example. So
Hmm.
I think it's really great news that this is effective by licensed psychotherapists, and it just increases the range of treatment options that we as consumers can choose to pursue, right?
Yeah, that's really interesting. Like asynchronous mental health intervention. Like you're saying, typically you think you have to drive to an office, sit for, an hour, but being able to get that on demand, or not necessarily on demand, but just reach out to somebody kind of whenever you need to connect with somebody. That's cool. Are there some other solutions that are not yet in place that you can think of that would have a big impact? Maybe like springboarding off that research you just completed?
Yeah, I mean, it there are just an incredible array of commercially available self-guided apps out there, for better or worse. And I say that because for better is there's a lot of potential and people, can empower people, and it's not very costly in many cases. However, they haven't all been subjected to research studies like we just did on the Talkspace platform.
Hmm.
So I think there's just a lot of opportunities, and importance of looking into these approaches to see, indeed, particularly for folks with real mental health conditions, is it helpful, and if so, how, and what kind of supports are needed, and how do we engage people and keep them involved, and so they don't just look at it once and think about it, but stay engaged and keep it alive, keep these strategies alive for themselves. So potential, but importance to do more work and to document what's helpful and what's not.
Yeah, absolutely. I could kind of foresee like this as the collaboration grows between healthcare providers, there's just going to be more and more frontiers opening up that we could continue to explore.
Mhm.
So we kind of talked about this a little bit, kind of here and there. But what are some of the biggest barriers regarding like implementation of behavioral health interventions in a primary care setting, or like you were talking about, maybe like one of the challenges of collaborative care is you kind of have to have buy-in from your organization. So can you just talk to
Yeah.
some of the biggest barriers it's facing?
Yeah, well, I mean, right. So collaborative care is the commitment, both financial and time, and how a practice structures, their services. So I think that's a really big barrier. And that's one way to do integrated care. There are other ways that can be really helpful as well. But I think, ongoing attention to increasing access and increasing engagement and decreasing stigma. So those are all really big barriers. There's a lot of ways to go about addressing all of those things, both at the practice level, at the societal level, where care is offered and how. So it's just a really big area with a lot of, that's good part of what I devote my career to, I would say.
Well, thank you so much. This is really an illuminating chat. We've had a chance to interact before, but I hadn't really get to hear your story and the work that you do. And I think there's some really interesting work that's being done, and of course, some areas to get into, especially for our AHEC scholars, as we're kind of helping them to become, think about some of those broader systemic things they can get involved with. I think this would be something very interesting to them. Maybe as like a final question before I let you go, what excites you about the work that you do? Or like if you had one thing that you just wanted to make sure that the students walk away from this conversation, what would that be?
Yeah, I think, well, that's a big question. I really like, when I think about the progression in my career, I really appreciate it. I really liked making a difference at the individual level and working with people one on one. But I really, really like this approach about taking a broader view and how can we make a difference at the population level or the system level, and what does that involve?
Mm.
So that's what I've really appreciated with my progression.
Awesome. Well, thank you so much, Dr. Ali, for your time. I'm sure this will be some great information for our students. And like I said, continue to use those ITS modules. We get overwhelmingly positive feedback about that and how helpful it can be for our students. So appreciate all of the support and help you've given to AHEC.
Absolutely. Thank you.
Thanks.